Most primary care physicians see these patients but don't recognize it. And so, for example, my patient came to my attention because while on a trip had developed a fever and was worked up for this fever, which turned out to be probably some sort of viral illness. But as a result, and she had some belly pain, so they did an abdominal ultrasound, and that's where they picked up hepatomegaly. She was actually seen by an infectious disease specialist before she was referred to me once the fever resolved, and she was typical of most patients who are relatively asymptomatic. She had no symptoms up until that point and still doesn't really have any symptoms from her cholesterol ester storage disease, except for a very soft, big liver. And so in patients who present with a big soft liver, usually it's because of storage of carbohydrate or fat. And so when I first saw her, that's exactly what she had. So I did some screening tests, including a lipid panel. For somebody who wasn't obese, had quite a high cholesterol, a low HDL, and a high LDL, which are typical markers for lysosomal acid lipase deficiency. So further testing confirmed that diagnosis.